It is calculated that approximately 2.7 billion passengers are carried by commercial airlines around the world per year. These passengers are exposed to medical emergencies during those commercial air flights. Hi, I'm Dr. Alberto Maud, neurointerventionalist at the Paul L. Foster School of Medicine here in El Paso, Texas. I am the director of the Stroke and Neurointerventional Services at University Medical Center of El Paso. In a recent study published in New England Journal of Medicine 2013, the epidemiology and the outcome of these medical emergencies during commercial air flights were known. Majority of these medical emergencies are relatively simple medical cases: nausea, vomiting, low blood pressure, pre-syncope, gastrointestinal symptoms, and respiratory symptoms. Fortunately, less than 1% of these medical emergencies are complicated cases, like, for example, cardiac arrest, heart attacks, or even strokes. It is estimated that approximately 44,000 in-flight medical emergencies happen per year around the world, which is equivalent at around 16 medical in-flight emergencies per 1 million of passengers, which is also equivalent to one flight will carry a medical emergency per 600 flights per year. Less than 1 out of 10 aircraft are diverted from the final destination. Knowing what to do in those in-flight medical emergency and have a plan of action, it is key to deliver a good outcome to these passengers that are suffering from a medical emergency. Let me tell you about the case that we recently here experienced at University Medical Center of El Paso. A 54 years old right-handed male took a direct commercial flight from Los Angeles International Airport to Houston International Airport. Approximately 45 after the aircraft departure from its origin, patient suffering from a massive stroke with symptoms consisted with paralysis of the right side of his body and difficult to talk. The pilots, along with the aircraft crew, decided to divert the plane to El Paso International Airport. EMS was waiting for the patient, and the patient was transferred to the nearest local hospital. Patient was emergently evaluated, and an acute non-contrast head CT ruled out the presence of a hemorrhagic stroke. It was confirmed that the patient was suffering from a massive ischemic stroke in the left side of his brain. Neurologists decided to refer the patient to University Medical Center of El Paso to perform an acute endovascular treatment of this massive stroke in the left side of the brain. The patient arrived to University Medical Center approximately 1 hour 55 minutes after symptoms onset. We were able to diagnose a complete occlusion of the left middle cerebral artery immediately after its origin. Patient underwent to an endovascular mechanical embolectomy using retrieval stent, and we were able to successfully pull the clot out and reperfuse the left middle cerebral artery within 2 hours 30 minutes after the symptoms onset. This resulted in a complete reversal of his massive stroke, and patient was transferred after with a normal neurological examination for post-op care at the intensive care unit. Happily, patient was able to walk out the hospital 72 hours later, went back to El Paso International Airport, and took finally a flight back to his hometown in Houston, Texas. Outcomes like this happen because of a combination of factors. One of the most important is the airline crew and the pilot having a good decision to divert the flight. Also, the EMS personnel or our local hospital rapidly assessing the patient and establish the diagnosis of an ischemic stroke and referring the patient quickly to UMC. And finally, the UMC personnel that move very fast to deliver the appropriate treatment to save that brain from a permanent damage.